It is my distinction and honor and privilege to introduce our next guest speaker who will be giving us our first keynote address. Dr. Southard joined the Los Angeles County Department of Mental Health as a director in 1998, before which he served in a similar capacity in Kern County for 5 years. He leads the largest public mental health system in the country, serving over 200,000 clients annually in one of the most ethnically diverse counties in the nation. The 2008 National Network for Social Work Managers Exemplar Award was presented to Dr. Southard in recognition for his outstanding achievement. Dr. Southard is the 2006 Social Worker of the Year for the National Association of Social Workers, the California chapter. He is the recipient of NAMI's 2003 Award for Excellence in Community Mental Health Services, presented in recognition for his ongoing efforts to building a comprehensive community care mental health system in Los Angeles County. He is the recipient of the 2003 Tom Bradley Equal Opportunity Award from the Los Angeles Metro chapter of the American Society of Public Administration. Dr. Southard is a past president of the California Mental Health Directors Association and a commissioner on the Los Angeles County Children and Families First 5 LA Commission. A licensed clinical social worker, Dr. Southard received his master's degree in social work from the University of California at Berkeley, after which he completed his postgraduate studies in social work at UCLA. Please join me in giving a warm welcome to Dr. Marvin J. Southard, Director of Los Angeles County Department of Mental Health.
Well, I have to begin by telling you what a wonderful pleasure it is for me to be here with you and to look out into the crowd and to see so many friends and friendly faces. I want to particularly to thank Jay Mahler for his kind words and his friendship and mentorship over the years. Jay, you've been an example to me about what we ought to be doing to create the opportunities for recovery, not just in LA, but throughout the state. So thank you, Jay. Years and years and years ago, when I was in college and I was taking classes in public speaking, one of the rules that they gave us was that you never, ever begin a talk by giving any kind of apology or disclaimer or anything like that, because your audience is giving you the two most valuable things that they have. They're giving you their time and their attention. And you should honor that by recognizing that you have prepared in the best possible way to be ready for today, for the talk that you're going to give. Now, as I begin my talk, it's going to sound like I'm going to break that rule. And so it's going to sound like I'm making a disclaimer, but it's not really a disclaimer. So bear with me. This is not meant to show you a lack of respect. I have some hesitation at presenting this talk on mental health and spirituality, not because I don't know something about the mental health field, because I have been working in this field for 35 years, embarrassing to say, nor is it because I don't know something about religion and spirituality, because actually I have had in my life the opportunity to study philosophy and theology. Now, the reason I have some hesitation in giving this talk is because of what spirituality is. You heard Reverend Murray yesterday talk about spirituality, that spirituality, the Hebrew word, meant wind, and the Greek word pneuma means breath, and the Latin word spiritus comes from the same root meaning. So we have a situation where the Hebrew and the Greek and the Latin for this all have the same root, which is breath or breathing. And it's my view that spirituality, because it has to do with breath, spirit is breath, like respiration, that spirituality is the province of all of us who breathe. If you are breathing, you have a spirituality. If you draw breath, you know about things spiritual. So every one of you in this room, because you are breathing, has insights into the nature of spirituality. And so I'm reluctant to speak on this because I am speaking, because I'm speaking to people who are breathing, people who have the breath of life in them, who are experts on spirituality. With that caveat, I will proceed and say also that Reverend Murray yesterday talked about the atheists who had the atheistic humanists and the humanistic atheists and other people who had hesitations about spirituality or seemed to be anti-spirituality. And I would even go so far as to say they too are speaking from a spiritual point of view because they are seeking meaning. They are both breathing and they are in that process of breathing, they are seeking to try to create meaning. And so Christopher Hitchens, who I have to say is one of my least favorite authors because he did a hit piece in Vanity Fair magazine on Mother Teresa that was really a piece of work. But Christopher Hitchens, there's a guy named Dawkins, there are people who are writing books as though they are attacking God. Well, you know, God doesn't really care. And what it shows, though, is that they are looking. People who are writing books about God, even if it appears that the books are against God, what it shows that they are on the path. They are looking. They are expressing where they are on their spiritual journey. As a matter of fact, the disclaimer comes from this reason. Say we have in this room a saint or an enlightened person. And say in this room we also have somebody who is spiritually blind and a sinner. I'm sure we have people in the latter category at least. The gap between that enlightened person and the worst sinner is small, tiny, infinitesimal compared with the gap between the most enlightened and the reality of the sacred that we are trying to touch. So all of us in this spiritual journey are all of us, wherever we are beginners and are looking for that beginner's mind. Another thing I need to say is I'm the oldest of five in a Catholic family, and so if at any time it sounds like I'm telling you what to do, that's not my intention. I'm really not trying to tell anybody what to do, but you know, I have some character flaws left. And so it may sometimes sound, either because of my job or because of my upbringing, that I'm telling you what to do. But really, please don't take it that way. Because this issue of spirituality is a common exploration for all of us. Another thing they told us in speech class those many years ago, that if you want to give a good speech, this is the formula. You tell people what you're going to tell them. Then you tell it to them, and then you summarize by telling them what you just told them. So I'm going to follow that formula. First, let me tell you what I'm going to tell you. First, I'm going to begin by talking about some definitions. And the definitions that I'll look into is a definition or a working definition of spirituality, a definition of religion, and a definition of recovery. Then I'm going to look into 3 specific ways in which spirituality can help with the process of recovery. And I will be talking about that in ways that are how spirituality helps all of us, whether we happen to have an active mental illness or not. Next, I will talk about the 3 great gifts that the client community has given to the provider and the mental health community and actually the public at large. Then I will talk about wellness and its connection to spirituality. And finally, I will make the case for why spirituality ought to be an important part of all things in the public mental health system. So let me start with the working definitions. These days, usually when I give some kind of a talk now and I got it prepared and I figure out what I'm going to say, I check it out by going to Wikipedia and checking out whatever my subject is on Wikipedia and see if what I have it matches what the people who do Wikipedia have done. And in general, I can say Wikipedia is a really wonderful tool, and that as I've looked things up in the past, I've found it immensely helpful. Not in this case. If you want some help or guidance with spirituality, don't go to Wikipedia. Because I think Wikipedia may have some difficulty with complex and controversial issues. Because if you look at the Wikipedia site, and I'm sure some of you will now that I mentioned it, it's just confusing. It says on this hand and this other. Anyway, it's very confusing and unclear conceptually, and in some ways, I think misleading. So I will use as our working definition of spirituality something that Reverend Murray used yesterday, that spirituality is the process of pursuing meaning and purpose in life. And so any activity that we undertake that has as its goal the pursuit of meaning and purposefulness in life is in some way a spirituality. So when people are writing books, and as I mentioned earlier, and those books are negative towards God, still, for that person, it may be a part of their spiritual journey and pursuit if they are doing that, not just to make money, but to pursue the process of purpose and meaning. So what is the relationship of spirituality to religion? In some ways, that was the least helpful part of the discussion that I found on Wikipedia. The definition of religion that we'll use is religion is a group or a community that is tied together by an agreed upon set of beliefs and rituals connected with the meaning of existence. So a religion implies a group or a community. A religion is never one. That's tied together by an agreed upon set of beliefs and rituals connected with the meaning of existence. Reverend Murray also referred to that. The Latin religion comes from a Latin word ligare, which means to tie. And the re part means to tie again. So religion is something that ties again. So in some interpretations of that, it's that we were once together, and religion is the thing that ties us once again together in the way that we ought to be. In any case, operationally, a religion is meant to tie people together. So it's not, in my view, and this is my view, that religion and spirituality ought to be seen in opposition to one another. Sometimes you'll see some definitions in which religion is called the calcification of spirituality. That when spirituality dies, it calcifies itself into a series of creeds and rules that is called religion. That's not my view. What I believe is that religion and spirituality are necessarily created for one another. They exist entirely to support one another. They don't make sense without one another. It's not merely that they're complementary, as you will sometimes say, where the spirituality is the private interior part of an experience, and religion is the exterior public side of that. I would argue that it is more, that any spirituality that is developed will reach out of the interior reality of what one person experiences and try to go forth and do things outside. And that movement from an interior experience that moves out and touches and helps and supports and creates connections with other people, that is the sort of thing that creates a religion. The flip side of that, if a religion does not support the creation of a genuine spiritual experience for the people who practice that religion, it's missing its point. The purpose of a religion is to create a community in which people have the opportunity to experience interiorly and touch the sacred. So, in my view, spirituality and religion are tied together. Each finds its purpose and fulfillment in the other. And as a matter of fact, I think you'll find that the most severe criticism that you will find of a religion that does not issue forth into supporting individual spiritual experiences comes from within religious traditions themselves. So, for example, if you looked at the Hebrew prophets, you would find Amos, Isaiah, Jeremiah, and Malachi all saying something like this. This is a paraphrase, it's not a direct quote, but they say it's something like this. The prophets have God saying, I detest your feast and your rituals. The din of your singing fills my ears. The smoke makes me sick. I reject those empty sacrifices. If you want to have a sacrifice that pleases me, let justice flow like water and goodness like an unfailing stream. A religion needs to produce, by its own account, in its members, the stream of justice and goodness that reaches out to others. So, spirituality and religion, in the long run, it may be different in an individual person or in an individual case, but in the long run, they need to develop together. So what's the role of faith? The spiritual master that I have been paying attention to lately, who's a monk named Thomas Keating, has said that with regard to spiritual practices, you don't need to believe anything in particular. All you need to do is do it and see what happens. Do it and see what happens. Now, I have to say, it takes at least a little bit of a mustard seed grain of faith to actually go out and do it. So maybe the role of faith isn't entirely discounted, but we all know what's possible with a mustard grain size of faith. Mountains can be moved. So faith, if you're not feeling a clear faith, that shouldn't stand in the way of finding the mustard seed and just doing it and seeing what happens. So we have investigated a little bit about a working definition of spirituality, a working definition of religion, their relationship. So now I'd like to spend a little bit of time talking about the other side of things that we have been concerned about today, which is a working definition of recovery. Recovery, in the sense that we're talking about today, is the first of the three conceptual gifts that the client community has given to the mental health community. Recovery did not originate as a result of scientific research. It did not originate from looking at the data about the number of people suffering from schizophrenia and schizoaffective disorder who actually had a bit improved life course, although that data was and is available. The recovery model came from the work of mental health clients as civil rights action groups in the 1970s. And from stories that Jay has told me through the years, I know about his involvement in those activities. And actually, I know about the involvement of other people in this room, clients in this room, in those activities. And what it really involved is, first of all, creation among the client communities of an awareness that they had something in common with each other, and they did not need, as Laura Mancuso was saying, to suffer alone. Their suffering brought them together. But their suffering then created the opportunity to look towards empowerment. So the fact of the suffering, the next step was to create a sense of empowerment, which was a part of the civil rights movement of those times, to use the pain and the suffering as a tool for improvement. And the third part of the recovery movement was to notice, to look at the data, and to notice that recovery was not just a concept, that it was a fact, and that with or without treatment, a number of persons suffering from severe mental illness did in fact recover and were able to make large contributing roles to society. And therefore, to say to somebody that their prognosis was poor, which for schizophrenia you meant that the expectation is that one's life would be entirely spent in institutions, that was a false prognosis. The data became available. And so what is recovery meaning? 40 years after the clients gave us this gift of the concept of recovery, I have to say that the meaning of that term is still evolving. It still has not completely clarified, and I think that's a good thing. But the recovery model has at least three elements. First element, recovery means what we would call social recovery. And the way of thinking of that is that one's illness and even all the symptoms of that illness may not go away, but with social recovery, the meaning and purpose of one's life is retained even though the symptoms may not have completely gone away. And guess what? If you have meaning and purpose and understanding in your life, and if your suffering makes kind of sense, then you can move forward with your life. Meaning creates the opportunity for understanding what you're going forward and creating opportunities to be of service, and that in itself creates more opportunities for recovery. So that's one sense of the meaning of recovery, social recovery. Second meaning of recovery is recovery like from an illness. So I had strep throat, I took my antibiotics, I rested, drank my chicken soup, and I recovered. An illness that I once had is gone. So sometimes when we talk about recovery, we talk about recovery in that sense, that an illness that had once plagued us is gone. In mental illness, that can occur, but it doesn't always occur. But it is a possibility. The third meaning of recovery is being in recovery, the kind of recovery that people who are in 12-step programs talk about, in which recovery is not something that is achieved at one point in time, but it is something and a way of life that is pursued throughout the whole of one's life. So when we talk about the recovery model, we mean social recovery. We mean in some part we mean being in recovery. And we're aiming at complete recovery. Those are the concepts that have been tied together when we are talking about recovery. And the exact components of that aren't clear yet. And as I say, I think that's a good thing because we have to live into the experience of knowing how that is going to operate. But what operationally does recovery mean? It means improved self-esteem. It means having a positive identity. It means living a meaningful role in the community. It means overcoming being stuck. It means improving one's basic level of functioning. And it's a funny thing, all of those elements, improving your self-esteem, positive identity, a meaningful role, not getting stuck, they fit with all three of those components. That's a part of complete recovery, social recovery, and 12-step recovery. So operationally, exactly what components go into the definition of recovery may be less important than the outcomes of recovery. And the outcomes of recovery, the client community has made really clear, which is a better and more meaningful life day to day. So how does spirituality work with recovery? Because it's clearly they're a relationship. If the essence of a recovery process is the discovery of meaning and purpose, and we heard earlier that the definition of spirituality was the process of seeking meaning and purpose in life, then it's clear that there ought to be some kind of relationship that is created by the opportunities for spirituality to create the conditions for recovery. We have both of them focusing on issues of meaning and purpose. Maybe it would be good for me to pause a moment and say, when we talk about spirituality, one of the weaknesses of that is that it can seem vague. Again, looking at the websites, if you Googled spirituality and went to the websites that come up, you get a host of different things that are, sometimes it's hard to see the connection between everything that comes up. But for the purposes of today, then, I will focus what we mean by spirituality being practices that people can engage in that support the finding of meaning and purpose in life that people can do. Now, it could be prayer, it could be meditation, it could be a ritual, it could be yoga, it could be chanting, it could be reading scripture, it could be a variety of different things as long as those things are undertaken with the goal of connecting with the sacred to find meaning and purpose in one's life. And these practices take different forms in different cultural contexts. So I'm not, in this instance, talking about supporting a particular practice. And one of the dangers that could happen, that must not happen as we evolve this idea of spirituality in public mental health, is the idea of the therapist as spiritual director. therapists should be allies in a variety of ways for clients leading a better life, but clients don't need a therapist as a spiritual director. What therapists should be able to do, and I'm sure we'll hear more about that later, is finding ways in their therapy to be supported in their spiritual quest, but not directed in their spiritual journey. I think that will be an important thing for us to work out as we figure all this out. So let me focus then. Think of a practice. Think of a practice that you have engaged in, you want to engage in, you've thought of engaged in, your neighbor is engaging in, something that you might want to do that you would consider to be a spiritual practice. And I want to talk about then now 3 ways in which any spiritual practice is meant to help in a recovery process. And I want to make clear, this is something that applies to anyone who was born and is breathing. So this is something that applies to all human beings, not just if you happen to have a mental illness or not. Because we're human beings and because we develop over time, every human being, not because you're a bad person, not because your parents didn't do what they were supposed to do, not because your culture was rigid, not because of any of those reasons, every human being will have issues as they develop and grow up and progress through time in 3 areas. One of those areas is everyone is going to have issues with control. Everyone will have issues with safety. Everyone will have issues with how they deal with how other people esteem them and the affection they need from other people. Now, the reason why everybody has issues in these areas is clear. The reason that everybody has issues in these areas is because we were all babies. And when we were babies, we had issues with these things. In order to survive, we needed to be kept safe. In order to survive, we had to have the bond created between us and our caregiver. And that there needed to be some kind of reciprocation that is created. If you look at the research, baby smiles and the wonderful face they make is an adaptive evolutionary response. Babies who don't do that have a much harder developmental time. So every one of us had issues as we grew up with control. How do we control ourselves? How do we control our environment? How do we stay safe? And what do we do with the esteem and an affection of other people? A spiritual practice is meant to help us grow and become aware of issues that come up in those areas of control, safety, and self-esteem. So I'll give you some minor league, not big league, but minor league examples from my own life in regard to those issues. First, control. I'm a boss of a big organization, so sometimes the control issues that I don't think I do have, and some of my staff I see smiling in the audience about the ways I exercise control that I don't know I'm exercising control. Now, control, it's not that control is a bad thing. You have to have a certain amount of control in your life. The issue is when you bring the problems related to control from your early childhood or your teenage years forward as though they were alive and real issues today, that's when it becomes a problem. It's also a problem when you're not aware of those control issues that you face. So, how do you know when an issue, well, I'll go through the other things and then I'll get to the how do you know. Second is safety. each of us has to find a way in which we stay safe in the world, and sometimes the safety issues are really clear and sometimes they're not. Sometimes the safety issues are really there and we're aware of them, and sometimes we're not. So for me, the safety issues are not the obvious safety issues. I was raised in I'm the oldest of 5, and my mother is the oldest of 10. And so I had, as I was growing up, 9 uncles and aunts who were looking out for me and making sure that all good things happened for me. So I was raised with the sense that things would work out. So my issues related to safety aren't that things won't work out. My issues related to safety are that I take for granted things will work out when maybe they won't. And so an example is I have to take a special effort to lock doors when I leave home. It was one of the issues that my wife and I used to fight about, is because it just wouldn't, it wouldn't cross my mind. And then when she would get angry at me for not locking the door, I would have a resentment. It would be, what are you getting so upset about? Nothing bad happened. Everything will work out. And so this brings me to the issue, how do you know you've got a problem? You've got a problem in an area when you have what's called an aversive emotion. If you feel anger or resentment or envy or upset or greed, any of those aversive emotions, you have those internal feelings, you know that there is an issue in you. Now, it could be that my wife also has an issue, but, frankly, that's her melodrama. My issue is the feeling of resentment created in me, and that's the part that I know, makes me know that I have an issue in the safety field. With the control field, to go back, for me, the control manifestation, and I'll talk about my family rather than the work, is that I'm the oldest of 5. My mom is having health problems. And so I thought that my good ideas, even though she lives in Arizona, would be what should be followed. And so I didn't tell my brothers and sisters they weren't really being very cooperative and smart by not taking my advice. But that was the attitude that they received. And as a result, whatever good ideas I might have had didn't get through in a helpful way to make my mother's situation better. Because I had a fantasy, unconscious, that somehow I ought to control what my brothers and sisters were doing in a way to help my mom. Now, it's not that my mom didn't need help, it's just my control fantasy did not create the opportunity for that to happen. So I have some control issues. But my big issues are in the area of esteem and affection of others. My weakness is that, I need people to, I guess I'm like Sally Field, people should like me. So I think. And one of the ways that didn't work for me was this. My kids, if they wanted to have a fight with me, we would talk. We would argue politics, religion, whatever. And they knew exactly what to say to make me ballistic. They could say 2 sentences and I would be dribbling food at the dinner table. And it took a while for me to realize what was going on with that. It's like, do I really need them to agree with me? Of course not. Is the argument about ideas a good thing? Yeah, it really is. But what I was experiencing was that their choice of argument meant that they were affiliating against me, that it wasn't really about the argument. They were secretly doing it because they didn't like me, and so realizing that the anger that I would feel in those arguments was really not about the content, but my internal issues, was an important piece of learning. And when I learned differently, it changed. So what I'm saying is all of us have issues related to safety and to the esteem and affection of others and to control. And whatever those issues are, our way of dealing with those things can be improved by engaging in a spiritual practice. That's one of the things that happens in a spiritual practice. But I have to say, it's not the purpose of the spiritual practice. You may, as a result of a spiritual practice, be more relaxed, but that's not why you engage in a spiritual practice. Engaging in a spiritual practice may make you lower your blood pressure, but you shouldn't engage in a spiritual practice in order to lower your blood pressure. All of those are side effects. The purpose of a spiritual practice is to engage that part of human experience that is in touch with hope and meaning. That is why spirituality is important. So, but anybody who engages, whether you have a mental illness or not, in a regular spiritual practice will have the opportunity to deal with the inevitable human issues of control, safety, and esteem and affection. And the results can be the experience of forgiveness, that you are able to forgive things that you didn't even know you were holding a grudge about, that you are able to experience reconciliation, that barriers that stood in the way of community and relationship that were there before suddenly aren't there, that there would be a reduction in judgmentalism, that your snap judgments about other people and what they meant to do and what they meant to say and why they were doing whatever they do, that decreases. And maybe most important of all, as you are no longer dependent on the affection and esteem of other people, you have a greater sense of your own inward self-autonomy. These are all the side effects of applying spirituality in anyone's life. So I've talked about the gift of recovery. I want to talk now about the gift of spirituality. Now I want to talk about the gift of hope. I won't go into hope as much as Reverend Murray did yesterday. I think that was the central point he was making, and the references he made to Viktor Frankl and his work, I think, are really important and instructive. But what I want to say is that in Los Angeles, we have a vision statement that goes like this. We create partnership with clients, families, and communities to support hope, wellness, and recovery. And that's a new vision statement that we created in the last several years. And that vision statement contains elements, the wellness element and the recovery element, we've been working on for literally 10 years. But the hope is the new part. And the hope part is added to our vision statement only because clients, including some clients in this room, demanded that we put it in. So hope is a clear gift from the client community to us as mental health providers and family members and the community at large. And every time I give a new employee orientation to orient the new people coming into the public mental health system, one of the things I do is ask them to be cognizant of the depth of gratitude that they ought to have to the clients who come into them and for services, because of the emphasis on hope and how that changes everything that we do. It makes our work so much more meaningful if it's focused on that arena of hope. If you look at the data from the research, you will find that spirituality, particularly the experience of hope in spirituality, is a very powerful variable for predicting better outcomes. And that's true in mental health, and it's true in physical health. So in this model that we're talking about, I think the equation is simple. Clients gave us the notion of the recovery model. It was a profound gift to all of us. We found, however, that the recovery model doesn't work without the inclusion of hope. So hope is the second gift. Then we find out that the sustaining hope is difficult without spirituality. So the first gift of the recovery model to us by the clients ended up creating the next step, which is the emphasis on hope, which is now creating the next step, which is the emphasis on spirituality. Because to work backwards, you can't have sustained hope without a spirituality. You can't have sustained recovery without hope. So hope and recovery and spirituality are tied together. I was going to talk a little bit about wellness. I'm closing in on time, so I'll do a short version of this. But recently, I had a birthday, and one of my friends, who some of you may know, John Ryan, gave me a book called Outliers. And in this book, Outliers, it talks about a strange experience that researchers had with a town called Roseto, Pennsylvania. Roseto, Pennsylvania is a little hill town obviously in Pennsylvania, where they noticed that people didn't get heart disease, people didn't get cancer, people didn't die except from old age. And so they were wondering, what's going on with this place? So they sent their researchers out, because this is really exciting, a place where everybody lives a long time. And so they thought, well, maybe it's because they brought from Sicily the eating and Mediterranean diet practices from Sicily, and that's why people are healthier. Well, they looked into it, and actually the people in Roseto were making their pizza with lard instead of olive oil. And they were heavy on the pepperoni, so it wasn't a diet. So the next they thought, well, maybe the people from Roseto are people with a extremely enduring physical stock, so maybe it's genetic. So what they did is they checked out other groups of families who had migrated from Roseto, Sicily to the U.S., but not to Roseto, Pennsylvania. And they found those other people from Roseto got sick and died like everybody else. So they were at a little concern about how to figure it out. So they sent teams of ethnographers into this town, and what they found was the protective factor for the people of Roseto was not either their genetics, nor their diet, nor their exercise. There were other towns in the neighborhood that had the same climate, had the same, had different ethnic stocks, but same working class, same hard work. So it was none of those things. What they found out it was, is in that town, people were well connected. They created a community. They supported one another. They, if you were doing really well, you did not, the social rule is you did not flaunt your success to make other people feel bad. If you were doing poorly, everybody helped out, so that it's not that there weren't differences in economic status, but those differences were not made the central thing. Everybody supported everyone else. In the town of 6,000 people, there were 22 different civic organizations. People were focused on the activities of their church. The protective factor ended up not being individual, not being dietary, not being exercise. It was in the creation of community. And so I think that's the lesson for us too in what we're trying here to do. So, the case for the public mental health system. The reason why spirituality ought to be this is the 5 reasons that spirituality ought to be included as a major factor in the public mental health system. First reason, everybody is on a spiritual journey, whether they know it or not, and clients are like everybody else. They need, just as clients need a safe place to live, a job, and supportive relationships, clients need spirituality as a part of their lives. So it should be a part of the public mental health system because it's a universal need. Clients are a part of that universe. Second reason why public mental health, why spirituality ought to be included in public mental health is because openness to spirituality is culturally competent. There are cultural populations for which spirituality and religion are very important issues. If the public mental health system is unresponsive, unwelcoming, not open to those issues of religion and spirituality, then it's a door closed to people who need to come in. Third reason that spirituality ought to be included in public mental health practice. It works. It's an evidence-based practice. It helps people. Anything that helps people ought to be part of a recovery-oriented mental health system. So insofar as we can do it in a proper and fitting way, we ought to support spirituality because it works. Fourth reason we need to include spirituality as a part of the public mental health system. This is the most powerful of all because the clients want it. Our clients are the reason our system exists. This is a dimension that they want some openness for. It's our responsibility then, in my view, of the public mental health system to do what, within the limits of what we can, what the clients want us to do. Fifth reason why the public mental health system needs to be open to spirituality and religion is because, and Supervisor Molina mentioned this yesterday morning, and it was also mentioned earlier today, is the public mental health system can't do everything for everyone alone. We don't have the resources to be able to care for large numbers of people for their whole life. We need to create the community partnerships that allow people to be cared for the way that we're cared for in our natural social networks. We need to find ways to substitute paid, professional caring and support for real, live community support like the residents of Roseto experienced. So in conclusion, how should we use these three gifts? The gift of hope, the gift of recovery, and the gift of spirituality that clients have given us. I believe that the way that we should use these three gifts, the gift of spirituality, the gift of hope, and the gift of recovery, is to create community. Our goal in using these tools, in using these gifts, is to try to create community. But what does community mean? Community comes from two Latin words. Com, that means with, and unus, which means one. So a community is those with whom we feel at one with. And it's our job as human beings, as we develop, to enlarge that circle of those whom we feel at one with. So when we're babies, we feel at one with our mother. That's our world. As we get a little older, it's our nuclear family, then our extended family, then our neighbors. Then it's who we define as people like us. And that may be defined geographically, it may be defined by religion, it may be defined by race. But we can't stop there. The spiritual challenge is to use our spirituality to increase that circle of those that we feel at one with. Our job is to always push the boundaries of that circle out, to make it ever larger. Sometimes religions can appear to be one of those boundaries. We feel at one with our religion. Even there, it's our spiritual goal to push beyond that boundary of the religion that we practice or are born into, so we can feel at one with even a larger circle. Because I think that is in the end what our spiritual goal is, to extend, as the Creator does, to extend the circle of those we feel at one with to all human beings, to everyone who breathes. That's the goal of what we're trying to accomplish. And we use our spiritual tools, our spiritual practices, to push those boundaries out. So ever more and ever further, we can feel at one with more and more human beings and make our community bigger and make our community better. I want to thank profoundly the client community for giving mental health the tools of hope, of recovery, and of spirituality to enable us to make our community bigger and better. Thank you.